the distance around your thigh predicts your risk of heart disease and dying early. And in one study, there was a surprisingly clear cutoff, and it was 60 centimeters, just under 24 inches. Danish researchers measured the thighs of nearly 2,800 adults and followed them for 12 and a half years. And below roughly 60 centimeters, the risk of heart disease and early death went up quite a bit. And the obvious explanation would be that people with thinner thighs were just thinner or less active or less healthy overall. But the researchers actually adjusted for a lot of these things. So they adjusted for smoking and physical activity and blood pressure. They also adjusted for cholesterol and BMI and even waist size. And the thigh finding was still there. And of course, 60 centimeters isn't some magic number that you need to hit, because measuring around your thigh doesn't really tell you how much of that is muscle and how much of that is fat. What this may really be telling us is that having too little muscle in your legs is a big problem as you get older. And a big reason is that muscle is one of the main places where your body puts glucose after you eat. It's a huge metabolic sink, and your thighs contain some of the biggest muscles in your body. So as you lose muscle, there's less tissue available to take up that glucose, which translates to higher sugars and your pancreas needing to work overtime to maintain normal glucose levels. So a bowl of pasta at 50 when you have strong legs and plenty of muscle isn't necessarily the same meal at 70 after you've lost a lot of that muscle. And there's another study that comes at this from a completely different direction. Researchers at King's College London measured leg power in more than 300 pairs of female twins, and they followed them for 10 years. And the women with more powerful legs held on to their memory and their processing speed much better. And even within a smaller subset of identical twins, so same genes but different leg strength, years later the stronger twin had more gray matter in the brain. Now there is one thing that's important to clarify in the original thigh study. Once thigh circumference got above 60 centimeters, the benefit basically stopped. Bigger thighs didn't keep lowering the risk, so this wasn't really a bigger is better finding. It looked more like a floor. And the beautiful thing about all of this, it's never too late to start rebuilding that muscle back. In one study, they worked with frail nursing home residents who were around 90 years old, and they did just 8 weeks of resistance training for their legs. And their strength went up 174%, and the amount of muscle in their thighs increased by 9% at 90 in just 8 weeks. And one thing I tell my patients, it's never too late to start. And if you're on Medicare, check your plan before paying for a gym. Some Medicare plans include free gym access through programs like Silver Sneakers or Renew Active or Silver and Fit.